Overview of Common Academic Challenges Faced by Health Professional Students by Dr. Holly Gooding and Dr. Jennifer Mecca in collaboration with the Harvard Macy Institute.
Welcome, and thank you for joining us for this discussion about cognitive learning principles used to improve teaching and learning in health sciences education. My name is Holly Gooding. I'm co-director of the Harvard Macy Institute program for educators in the health professions. I'm also assistant professor of medicine and pediatrics at Harvard Medical School. I'm pleased to be joined today by Dr. Jennifer Mecca. Jennifer is the director of cognitive skills programs and the Woodward Center for Excellence in Health Sciences Education at Penn State College of Medicine. Jennifer, thank you for joining me today.
Thanks for having me, Holly.
So I know you and I have talked a lot about this issue, and I'm so excited to have you here to share your expertise. Let's start by just talking about what are some of the common issues that students face in medical school.
Thanks, Holly. I think that it's really important for us to be thinking about what are some of these common issues, as well as what are some things that we as educators can do to help address the issues in teaching and in helping students with learning. So one of the most common issues that students struggle with, especially as they're entering different phases of their training in medical school, is time management. Time management, trying to learn too much information, learning for recognition, not understanding. Also, self-assessment, collaboration. A lot of times when students enter medical school, they're still trying to find where they are, trying to find out some of their different peers, where do they fit in with those peer groups, and building their self-confidence and the knowledge and experiences that they've had. It also then comes into some conversations about reflection as well as metacognition.
So let's unpack some of that by starting to talk about some of the evidence behind successful learning strategies and how that might help us to counsel students who are having the problems you just described.
Absolutely. And so I think the first thing that's really important for us to be thinking about is time management and having conversations with our learners about how to approach their studying and their approaches to learning in order to make the best use of their time. So we know that there's a tendency for people to, especially when they're learning a lot of information, to want to just try to keep moving through it and try to cram it all in the day before the exam or the day before the test. And with the pace and the volume of information that students need to learn to be successful in medical school, that's not really an option. So it's important for us to be helping our learners with building in time for spaced practice and spaced review of material. And that review should be cumulative in order to help with retention and with application of information.
So let's talk about spaced learning and contrast it to massed learning. I'm not sure those are terms that are going to be familiar to all of our viewers. So tell me a little bit more about what you mean by spaced versus massed review.
So when we think about massed review, that would be when someone is continuing to go through information. They go from lecture on Monday, lecture on Tuesday, lecture on Wednesday, or whatever your curriculum looks like. And then if they have an exam on Friday, Thursday night, they start going back through all of the information from Monday, Tuesday, Wednesday, Thursday. In contrast to something like spaced review, where on Monday I'm going to spend some time reviewing Monday's material. On Tuesday I'm going to spend some time reviewing Tuesday's material, as well as going back to some of the key concepts and maybe even some of the more difficult concepts that I'm still struggling to understand on Tuesday, so that every day you're spending a little bit of some time, or every other day, to go back and revisit those concepts, so that then Thursday night you can really focus on what are some of the key concepts from the entire week, rather than trying to learn it all in one sitting.
So it's really about spacing out the learning over time and even allowing yourself to forget a little bit and then go back and have to remember, as opposed to that more classic cram or study and dump. I study all this night and then I take my test tomorrow and then I forget about it and never look at that material again.
Absolutely.
Even with spacing out learning over time, I'm sure you hear, as I hear, that there's still just so much material to learn. How do you help students with that?
Well, it's really important for us to help students understand the different phases of learning and how people learn. So if we think about general information processing, you have information that comes into sensory memory, And then the ideal is for it to go into working memory, and from working memory into long-term memory. And when we think about what helps with storing information in long-term memory, it has to do with organization and also retrieval. So in order to help support that retention, you want to be kind of working back and forth and pulling out that information, practicing using it, thinking about how it relates to other concepts you already know, or as you're learning new information, how those concepts relate to one another. And so when I talk with students about learning and when I talk with our faculty about how to best approach teaching, we talk a little bit about those three different phases. So there's an acquisition, maintenance, and then developing proficiency. And there are different strategies that we can help our learners do at each of those phases to help promote successful storage in long-term memory so that ideally they can pull it out at a later date to use it, whether it's within a quiz or a test or later on as they're practicing or future careers as physicians.
One of the things that I think about in this area, which is a term that will probably be familiar to many of our viewers, is the idea of activating prior knowledge. Because if I have some prior knowledge in my long-term memory that I can then scaffold upon or build upon as I'm taking in that new knowledge in terms of my incoming information, then it's more likely that I'll be able to organize that and remember it in the future. Would you agree with that?
Absolutely. The more you can help students activate what they already know and start to think about how those concepts relate to one another or what the connections might be or even how they're different, the easier it will be for them to then be able to pull it out and use that information later on.
And we know that comparing and contrasting is exceptionally important for students to be able to then apply information, particularly when it's presented to them in another setting, right, like in the hospital versus in the classroom.
Absolutely. Along those same lines, it's really important in those strategies, as you just mentioned, can really help our learners to go from a shallow level of processing to a deep level of processing. And when we think about shallow processing, we're really thinking about when we have people or students, or even ourselves sometimes, when we're focusing on meaningless pieces of information or just trying to memorize definitions but not understanding the actual concepts, rather than focusing on how that information relates to what you already know, how this might present, how would a patient look who had this disease, when might I use this drug if a patient had a certain prior illness or they had certain allergies, what considerations you need to take into place, rather than just trying to memorize some specific details about a drug or about a disease. So the more that we can help our learners to go from just trying to approach and memorizing the details to understanding the concepts, the deeper their learning is, and the better, again, that is with helping with our long-term retention as well. And then being able to apply and transfer that information, which really is the goal. As we're training our students and as we're looking at preparing students for clerkships and beyond, we need them to be able to transfer something that's very difficult for them. So the more deep they can be with their learning, rather than focusing on those superficial elements, the better it will be to help support transfer.
It's really a different way of thinking and of teaching than many of us recall from our own time in health profession school, when memorization of list of, say, a differential diagnosis or a set of side effects to a particular drug was really what was valued, the ability to enumerate a long list, what are the possible causes of a right upper quadrant pain or something like that. And while valuable, certainly, to have that information, the ability to actually look at a case, a clinical case, and to diagnose it, one needs to be able to understand the actual deeper learning behind those lists and not just a list of causes.
Right, because then if they see that case later on, or they see some variation of that case, we need them to be able to apply that knowledge regardless of how it presents. And we know that it's not going to present the exact same way as the way they might have memorized it in the list.
And we hear this all the time from our clinical faculty. They encounter students who may have aced all of the test in the preclinical phase of whatever health professional school they're in, and then they're confronted with the patient who maybe looks just a little bit different than the example patient that they saw in the classroom, and they get stuck.
Right.
Whereas if we can encourage some of that deeper processing, we hopefully can encourage those problem-solving skills that students will need once they need to actually apply the information.
Absolutely. And I'm sure that you hear students or even faculty talk about it as well, where they might see a patient one day who has a similar presentation to a patient they see the next day, but they're not able to make that connection. So the more that we can help our learners to go a little bit deeper and to help do some of that compare and contrast, or to ask some of those questions about how else might someone present? What else might you look for? What else might you expect to see? The more you can help support that transfer of knowledge and understanding.